Frontline workers have had to endure long hours to help treat many COVID-19 patients. We checked in with 2 medical workers to give their insight on their experiences throughout this pandemic.
Hi, my name is Bill Sweezy. I'm a respiratory therapist.
My name is Paige Farella, and I'm a registered nurse.
My occupation and involvement in treating patients with COVID-19 is that I'm a respiratory therapist. Say the doctor wants to find out more detailed information about the lung status of the patient. We test to make sure that they're, breathing okay by measuring their blood values. We also work in the intensive care unit where we manage the ventilators.
When a patient arrives to the hospital, they are asked a series of screening questions. From there, people are filtered into a clean area or a dirty area. So once they go into a positive area, we as healthcare workers will always wear a gown, gloves, eye protection, and an N95 or a P100 mask. Now, if you have a clean patient, then obviously you're just wearing a surgical mask, gloves when necessary, and eye protection. Being pregnant, I now wear my N95 100% of the time. My N95 on, surgical mask on, and my goggles. And that is what I look like all day long. I have had to quarantine from exposure to COVID. You get in touch with the hospital pays for your COVID test, the hospital pays for your time off, and then you come back when you have negative tests.
COVID-19 has impacted my life in a positive way. I've gotten plenty of work. The bad side, unfortunately, is that one of my jobs actually is to take the breathing tube out once they don't need it anymore. Once they're placed on mechanical ventilation, they rarely survive. So it's really sad. And it can be hard when there's not enough beds for COVID-19 patients. Well, right now, the governor, he's trying to change some of the rules for staffing ratios. In normal times, the nursing ratio for a nurse to patient can be 1 nurse for 2 patients. And now the staffing ratios for intensive care can be 1 to 3. Statewide and nationally, there's not enough staff to take care of all these patients. And so as the number of patients in the hospital increases, they're running out of those rooms.
Do I think we have tackled it effectively? No. I think when it first came out, we were doing really well. The problem is that we didn't have the next steps ready. It's evident now with all of the lack of resources we have that we did not prepare properly, unfortunately. If you're going out, just wear your mask, take your vitamins, especially D3, zinc, magnesium, vitamin C, to really give yourself the best chance.
Truthfully, I hope that people continue to wear masks and respect social distancing and don't start to gather. I know the vaccine has just arrived. While we're waiting for everyone to get their shots, respect what the guidelines and the recommendations that have been put forth by our government. Just people need to continue to be safe.
My advice would be to have faith, and life will continue, but we just have to get through this time. I know how hard it's been on students especially, and I, applaud all of you who are doing homeschooling. I just want to give you encouragement and tell you to seek help when you need it. History proves we've done it before, so we can do it again.